Today, I want to talk directly to you about a topic that is incredibly important for men's overall well-being: achieving and maintaining strong, long-lasting erections. This is not just about sexual performance, it's about your sexual health as an integral part of your quality of life. Understanding how erections work and what you can do to support them can empower you to take control of your vascular and neurological health, leading to better outcomes both in and out of the bedroom. Erectile function depends heavily on the intricate interaction between vascular health and neurological control. When these systems work harmoniously, the result is a firm and sustainable erection. However, various lifestyle factors and medical conditions can disrupt this delicate balance, leading to difficulties with maintaining erections. That's why it's essential to understand the physiological foundations behind erections and recognize how lifestyle choices and medical interventions can support or hinder this process. Let's start by briefly exploring why penile vascular health is so critical. The penis is a highly vascular organ, meaning it relies on a rich network of blood vessels to fill and sustain an erection. When sexual arousal occurs, signals from the brain and local nerves trigger the relaxation of smooth muscles in the penile arteries, allowing increased blood flow into the corpora cavernosa, the two cylindrical chambers running along the length of the penis. This blood fills the spaces within the corpora cavernosa, causing the penis to swell and become rigid. At the same time, the veins that normally drain blood from the penis compress, helping to trap the blood inside and maintain the erection. This entire process hinges on healthy blood vessels and efficient neurological signaling. If there is any impairment in the blood flow or nerve function, the ability to achieve and sustain an erection may be compromised. For instance, conditions such as atherosclerosis, the narrowing and hardening of arteries, can reduce the blood supply to penile tissue. Similarly, nerve damage from diabetes or injury can disrupt the communication necessary for an erection to initiate and maintain. Beyond the physical structures, hormonal balance also plays a significant role. Testosterone, the primary male sex hormone, influences libido and erectile function. Low testosterone levels can reduce sexual desire and contribute to erectile difficulties. Additionally, psychological factors such as stress, anxiety, and depression can interfere with the neurological signals that initiate erections, making mental health an often overlooked but crucial component of sexual health. Understanding these physiological mechanisms helps us appreciate why erectile difficulties are often a signal of underlying vascular or neurological issues. This is why erectile function is sometimes described as a window into men's overall cardiovascular health. Addressing erectile problems early can lead not only to improved sexual health, but also to the detection and management of systemic health concerns. In this series, I will guide you through evidence-based techniques and strategies that can enhance your erectile function by focusing on vascular health and neurological support. We will explore exercises that strengthen the pelvic floor muscles, which play a vital role in controlling erections and ejaculation. You'll also learn about non-invasive devices designed to improve blood flow, as well as lifestyle changes that promote vascular integrity and hormonal balance. Before we move on to these techniques, it's important to emphasize that erectile function is complex and individualized. What works for one person may not be the best approach for another. Therefore, consulting a healthcare professional to identify any underlying medical conditions and to tailor interventions to your specific needs is a critical step. In summary, maintaining strong, long-lasting erections involves a sophisticated interplay between blood flow, nerve signaling, hormonal influences, and psychological well-being. The health of your penile vascular system and the supporting neurological pathways is central to this process. By understanding these foundations, you can better appreciate the importance of targeted interventions and healthy lifestyle choices that support sexual health. As we proceed further in this series, keep in mind that sustaining erectile function is not just about immediate results, but about fostering long-term vascular health and neurological resilience. The techniques I will share are designed to complement medical care, optimize blood flow, and enhance muscle control, all of which contribute to improved erectile quality. Now that we have set the stage with this overview of penile vascular health and neurological function, we will next delve deeper into the physiology of erection. I will explain the specific mechanisms by which blood flow increases, how smooth muscle relaxation is regulated, and the role of venous occlusion in maintaining rigidity. This foundational knowledge will prepare you to understand why the exercises and devices we discuss later can be so effective. Remember, the goal here is to empower you with knowledge and practical tools that can help you achieve better sexual health. Erectile function is a vital aspect of men's health, and maintaining it requires attention to vascular health, neurological function, and overall well-being. Thank you for joining me in this first part of the series. I'm confident that by understanding the physiology and factors influencing erectile function, you will be better equipped to take proactive steps towards sustaining your sexual health. Next, we'll dive into the fascinating physiology behind erection and the key factors that contribute to its success. Stay with me. Now that we have a general understanding of the importance of penile vascular health and neurological function in sustaining erections, let's dive deeper into the physiology behind this complex process. I want to explain how the nervous system, hormones, and vascular structures work together to create and maintain an erection. By understanding these mechanisms, you'll better appreciate why certain techniques and therapies can have such a positive impact on erectile function. The process of achieving an erection begins with sexual arousal, which can be triggered by psychological stimuli such as thoughts or visual cues, as well as physical stimulation. When the brain perceives these stimuli, it sends signals through the nervous system to the penile tissue. Specifically, the parasympathetic nervous system activates neurons that release neurotransmitters, including nitric oxide, a key molecule in this process. Nitric oxide acts on the smooth muscle cells lining the arteries and the trabecular smooth muscle inside the corpora cavernosa, the two sponge-like chambers of the penis. It causes these muscles to relax, which is critical because when the smooth muscle relaxes, the arteries dilate, allowing increased arterial blood flow into the corpora cavernosa. This influx of blood fills the spaces within these chambers, causing the penis to expand and become rigid. Simultaneously, the veins that normally drain blood from the penis are compressed against the tunica albuginea, a fibrous envelope surrounding the corpora cavernosa. This compression reduces the outflow of blood, effectively trapping it within the penile tissue and maintaining the erection. This phenomenon is known as venous occlusion, and it's essential for sustaining rigidity during sexual activity. Hormones also play an important role in supporting erectile function. Testosterone, produced mainly by the testes, influences libido and the responsiveness of penile tissue to neural signals. Low testosterone levels can decrease sexual desire and impair the physiological processes required for an erection. Other hormones, like prolactin and thyroid hormones, can also impact sexual function, but testosterone remains the primary hormonal driver. Of course, the entire system must be finely balanced. Any disruption in the nervous signals, vascular dilation, or venous occlusion can lead to difficulties in achieving or maintaining an erection. For example, endothelial dysfunction, a condition where the lining of blood vessels fails to function normally, is a common culprit. This dysfunction impairs nitric oxide availability, which reduces smooth muscle relaxation and limits blood flow to the penis. It's often associated with cardiovascular risk factors such as hypertension, high cholesterol, and smoking. Diabetes is another major factor that can impair erectile function. High blood sugar levels can damage both blood vessels and nerves, leading to reduced arterial inflow and impaired neurological signaling. Additionally, diabetes affects the production and action of nitric oxide, further complicating the process. Stress and psychological factors should not be underestimated either. Chronic stress increases sympathetic nervous system activity, which opposes the parasympathetic actions needed for erection. Anxiety and depression can alter brain chemistry and reduce sexual desire, further inhibiting the initiation of erections. This interplay between mind and body underscores the importance of addressing psychological health alongside physical health in managing erectile dysfunction. Understanding these mechanisms highlights why focusing on penile vascular health is so critical. Strategies that improve endothelial function, promote smooth muscle relaxation, and enhance blood flow can have significant benefits. Lifestyle changes such as regular exercise, a balanced diet, smoking cessation, and stress management are foundational. These interventions improve cardiovascular health overall and support the penile vascular system specifically. Medical therapies often aim to enhance nitric oxide signaling pathways or increase testosterone levels when necessary. Phosphodiesterase type 5 inhibitors, for example, work by preserving cyclic GMP, a molecule that promotes smooth muscle relaxation and blood vessel dilation, thereby facilitating erections. However, these medications are most effective when underlying vascular and neurological health is optimized. In addition to pharmacological options, physical therapies and exercises targeting the muscles involved in erection can enhance penile blood flow and muscle tone. Strengthening the pelvic floor muscles, for example, can improve rigidity and erectile endurance by supporting venous occlusion. We will explore these techniques in upcoming sections. To summarize this physiological overview, erection is a finely tuned event that requires coordinated nervous system activation, hormonal support, and vascular responses. The key physiological steps include parasympathetic nerve activation, nitric oxide-mediated smooth muscle relaxation, increased arterial blood flow into the corpora cavernosa, and venous occlusion to trap blood within the penis. Disruptions in any of these steps, whether due to vascular disease, nerve injury, hormonal imbalances, or psychological issues, can lead to erectile difficulties. Recognizing the vascular basis of erection is particularly important because it establishes erectile dysfunction as a potential marker for broader cardiovascular health problems. Many men experience erectile difficulties years before other cardiovascular symptoms appear, making early evaluation and intervention critical. This physiological insight also sets the foundation for understanding how targeted exercises, devices, and lifestyle modifications can improve erectile function. By enhancing blood flow, supporting smooth muscle health, and improving neurological control, these interventions can restore or augment natural erectile mechanisms. In the next part of this series, I will guide you through the first practical technique: pelvic floor muscle training, commonly known as Kegel exercises. These exercises strengthen the muscles that play an important role in maintaining erections and controlling ejaculation. You'll learn how to identify the correct muscles, perform the exercises properly, and incorporate them into your daily routine for maximum benefit. Remember, erectile function is multifactorial, and improving it requires a comprehensive approach that addresses vascular health, neurological function, hormonal balance, and psychological well-being. Understanding the underlying physiology is your first step toward making informed decisions and adopting effective strategies. Thank you for staying with me. Together, we will explore how the body's natural systems can be supported and strengthened to achieve better sexual health and long-lasting erections. I look forward to sharing these expert-backed techniques with you in the next segment. Now that you have a solid understanding of the physiology behind erection and the key factors involved, it's time to move into practical territory. The first technique I want to introduce is pelvic floor muscle training, commonly known as Kegel exercises. These exercises specifically target the muscles that play a crucial role in erectile function and ejaculation control. By strengthening these muscles, you can improve rigidity, prolong erection duration, and enhance overall sexual stamina. The pelvic floor muscles form a hammock-like support structure at the base of your pelvis. Among these muscles, the pubococcygeus muscle is particularly important for erectile function. When these muscles contract, they help compress the veins that drain blood from the penis, supporting venous occlusion and maintaining the erection. Additionally, strong pelvic floor muscles contribute to better control over ejaculation and can reduce premature ejaculation. Many men are surprised to learn that they can consciously strengthen these muscles with targeted exercises. The first challenge is identifying the correct muscles. A simple way to locate your pelvic floor muscles is to try stopping your urine stream mid-flow. The muscles you contract to do this are your pelvic floor muscles. It's important to note that this is just a test to identify the muscles. You should not regularly stop urination midstream as a form of exercise, because it can lead to urinary issues. Once you have identified the pelvic floor muscles, the next step is to perform Kegel exercises properly. Here's how to do it. 1. Begin by sitting or lying down comfortably in a relaxed position. 2. Tighten your pelvic floor muscles by contracting them as if you are trying to stop the flow of urine or prevent passing gas. 3. Hold the contraction for about 3 to 5 seconds, focusing on tightening the muscles without tensing your abdomen, buttocks, or thighs. 4. Slowly relax the muscles for another 3 to 5 seconds. 5. Repeat this contraction and relaxation cycle 10 to 15 times per session. It's beneficial to perform these exercises 3 times per day, ideally spaced throughout the day for consistent muscle engagement. Over time, as your muscles gain strength, you can gradually increase the duration of each contraction and the number of repetitions. Consistency is key. Just like any other muscle training, pelvic floor exercises require regular practice to yield noticeable improvements. You may begin to observe enhanced erectile rigidity and better control during sexual activity after about 4 to 6 weeks of consistent training. One important tip is to breathe normally while performing the exercises and avoid holding your breath. Also, ensure that you're isolating the pelvic floor muscles without engaging your abdominal or gluteal muscles, as this can reduce the effectiveness of the exercises. For some men, integrating Kegel exercises into their daily routine can be challenging initially. Try associating the exercises with regular activities, such as brushing your teeth, waiting at a stoplight, or during breaks at work. This helps form a habit and makes it easier to maintain the practice long-term. In addition to improving erectile function, pelvic floor muscle training may also benefit urinary continence and overall pelvic health, providing additional motivation to stay committed to the exercises. If you experience difficulty identifying the correct muscles or performing the exercises properly, you may benefit from guidance by a healthcare professional specializing in pelvic health. Techniques such as biofeedback or physical therapy can assist in proper muscle engagement and optimize your training. It's also worth mentioning that pelvic floor muscle training is a safe and non-invasive method with no known adverse effects when performed correctly. This makes it an excellent first-line approach for men seeking to improve erectile function naturally. By improving the strength and endurance of the pelvic floor muscles, you directly support the mechanism responsible for venous occlusion during an erection, enhancing the ability to maintain firmness. Additionally, better muscle tone contributes to improved sexual stamina, allowing for longer-lasting and more satisfying sexual experiences. To summarize, here are the key points for effective pelvic floor muscle training. Identify the correct muscles by attempting to stop the flow of urine. Perform slow contractions and relaxations, holding each for 3 to 5 seconds. Avoid engaging surrounding muscles like the abdomen or glutes. Breathe normally throughout each exercise. Repeat 10 to 15 times per set, 3 times daily. Be consistent and patient. Improvements typically occur after several weeks. Consider professional guidance if you have difficulty performing the exercises. In our next segment, we will explore another valuable technique, the use of vacuum erection devices, or VEDs. These devices offer a non-invasive method to assist men in achieving erections by mechanically enhancing blood flow into the penis. We'll discuss how to use them safely, their benefits, and their role in penile rehabilitation programs. For now, I encourage you to start incorporating pelvic floor muscle training into your daily routine. Practice these exercises consistently, and you will begin to notice a significant improvement in your erectile function and sexual stamina over time. Remember, supporting your vascular health and neurological control through targeted techniques like Kegel exercises can empower you to regain confidence and improve your sexual health. Stay committed, and I look forward to guiding you through the next steps on this journey. Moving forward, let's discuss another effective method to support erectile function: vacuum erection devices, commonly known as VEDs. These non-invasive tools can be valuable for men who experience difficulties achieving erections naturally or as part of a penile rehabilitation program following surgery or injury. A vacuum erection device consists of a clear plastic cylinder that fits over the penis, a pump mechanism that creates negative pressure, and a constriction ring that is placed at the base of the penis once the erection is achieved. The principle behind VEDs is straightforward. By creating a vacuum around the penile tissue, the device draws blood into the corpora cavernosa, facilitating an erection. Using a vacuum erection device can be both a temporary aid and a therapeutic tool. For instance, men who have trouble initiating erections may find that VEDs help them achieve sufficient rigidity for sexual activity. Additionally, VEDs can promote penile health by improving blood circulation and oxygenation of the tissue, which is particularly important after prostate surgery or in cases of nerve damage. Let me walk you through the proper use of a vacuum erection device to ensure safety and effectiveness. 1. Begin by selecting the appropriate cylinder size for your penis to ensure a comfortable and secure fit. The cylinder should fit snugly without causing pain or excessive pressure. 2. Before insertion, apply a water-based lubricant to the base of the penis and the inside of the cylinder to create a good seal. 3. Insert the penis into the cylinder, making sure it is fully enclosed. 4. Use the pump, either manual or battery-operated, to gradually create a vacuum inside the cylinder. This negative pressure draws blood into the penile chambers, causing it to enlarge and become rigid. 5. Once an adequate erection is achieved, slide the constriction ring from the base of the cylinder onto the base of the penis. This ring helps maintain the erection by preventing blood from flowing back out. 6. Remove the cylinder carefully, leaving the constriction ring in place. 7. The constriction ring should not be left on for more than 30 minutes to avoid potential tissue damage. 8. After sexual activity or when the erection is no longer needed, remove the constriction ring gently. When using a vacuum erection device, it is essential to follow safety precautions. Avoid excessive suction, which can cause bruising or pain. If you experience numbness, discoloration, or persistent discomfort, discontinue use and consult your healthcare provider. Medical supervision is recommended, especially for men with underlying conditions such as bleeding disorders, penile anatomical abnormalities, or those using blood-thinning medications. A healthcare professional can provide guidance on selecting the right device, instruct on proper use, and monitor for any complications. One of the advantages of VEDs is that they do not rely on nerve function or pharmacological agents to produce an erection, making them useful for men with nerve injury or diabetes-related erectile dysfunction. Furthermore, regular use of vacuum devices may improve endothelial function and promote tissue health by increasing blood flow, which can contribute to better spontaneous erections over time. Studies have shown that incorporating vacuum erection devices into penile rehabilitation programs after prostate surgery can help preserve penile length and prevent fibrosis, a condition where tissue becomes scarred and less elastic. This rehabilitative effect underscores the dual role of VEDs as both an immediate aid and a long-term therapeutic strategy. It's important to set realistic expectations when using vacuum erection devices. While many men achieve satisfactory erections, some may find the device cumbersome or experience a temporary loss of sensation. Practicing with the device alone before engaging in sexual activity can help you become more comfortable and confident.